Doctors, as I told you, they are trained to look at you as only a case. They are trained to look at you as a person with a disease and what sort of a medicine can clear your disease. But he is not into this sort of a product. So mostly he thinks of creating an environment into your body to clear the disease. Nothing more than that. Now how to promote this is very difficult. He doesn't see beyond the medicine. He won't see prevention. If your doctor gives you a lecture on prevention, he will have only 2 patients there. Rest of the patients will go to another doctor. So how to talk about this? Now you see, in marketing, there are 2 ways to do that. One, direct marketing. Means you talk directly about the products and its benefits and its uses. Now if you talk about the second way of marketing is surrogate marketing. In surrogate marketing system, you don't talk directly about the product. You go around and come, and ultimately you came around for the product. Ultimately that he has to use our product. That's a very simple thing. Doing business is later. First is he has to use the product. He has to accept the product. So I designed a special program for a doctor. And the topic of that, the title of that is Concerns and Dreams of a Doctor, of a physician rather. Concerns and Dreams of a Physician. Now, when I go for a presentation with a doctor, I ask a simple question. I don't talk about Ganoderma. I talk a question. Doctor, in your long experience, I would like to learn from you. What is your concern in treating your patient? Now the doctor, he blinks. What is my concern of treating a patient? You are a well experienced person, no doctor. You know very well what is your concern. Then I immediately open my laptop. I don't want to embarrass him too much. So I open my laptop and show him. The first concern of any physician will be, the patient I am treating should recover very fast. Doctor, is it not your concern? Yes. This is my concern. I don't want to treat the fellow for 10 years. He should recover very well. Very good, doctor. Convinced. Thank you very much. The next concern. The medicine I use should help in the recovery faster. Is it right, doctor? Yes. I choose the best medicine. Now tell me which doctor will say that, I use the wrong medicine. I will always say, so you get an yes answer from a doctor. Okay, you use the best. Very good, doctor. It's an excellent concern. Very good. The third one, concern. The medicine I use should produce the least side effect or no side effect. Is it not so, doctor? Yes. I am very concerned about the medicines and the side effects. I always lose. Very good, doctor. Very nice. I learned a lot from you. Very good. And the fourth concern, it is called tachyphylaxis. Now the tachyphylaxis is a technical terminology. It is called dose insufficiency. Now what is this? It's a very simple thing. The doctor understands this very easily, but I can explain to you. For example, I have a joint pain. Okay. Now doctor gives me an anti-inflammatory product, 1 tablet. You take 1 tablet for 1 week. So I took for about a week's time. So my pain is gone. After 2 weeks, I go to the doctor again. Doctor, 1 tablet was very good. Thank you, doctor. But my pain has come again. Oh, the pain has come. You take 2 tablets. So I took 2 tablets. After 2 weeks, I go there. And doctor, pain is not going. Doctor says, you take 3 tablets. Now, this is a problem every doctor is encountering while treating his patient. Because there is a dose insufficiency. We do not know at what dose the patient gets cleared. So I go for a new medicine. And again the same story. Supposing a product can help in a dose sufficiency, will you use that product or not? Yeah, why not? Definitely I will use. Okay. These are the 4 concerns. Doctor, please tell me, if any product if I give you, if it addresses all the 4 concerns, will you use or not? Now please tell me which doctor will say, I will not use such a product. You say, yeah, why not? I can consider. He cannot say immediately, okay, I will use. Okay, I can consider. Very good. What is the next one? It's called the dream of a doctor. Doctor, please tell me, what is the dream when you treat your patient? Now doctor laughs. He says, I don't dream when I treat my patient, man. How do I dream? No, doctor, it is like this. See, in our practice what happened? A diabetes patient comes, so you give a diabetes medicine. A person with a high BP come, you give a high BP medicine. A person with a joint pain come, you give a joint pain medicine. So, one medicine for one disease. So, what you give as an anti-diabetic does not work for reducing your blood pressure. What you give for high blood pressure does not relieve your joint pain. So, different medicine for different diseases. Now, supposing if you got a single solution for multiple problems, how would you like it? How would I like it? It can only be a dream. It cannot happen in my lifetime, the doctor tells. If it can happen in your lifetime, fine, doctor. Supposing you have it in your hand, what will you do? Will you use it or not? Yeah, which doctor will say no? I will definitely try it, why not? Then you open the flip immediately. Ganoderma opens the whole thing. The Ganoderma is a single solution for multiple problems. Now, after that I started promoting about Ganoderma, then what are the ingredients of it, what is the technicalities of the product. I have got a separate module for doctors. Supposing, for example, you have got organic germanium. Now, organic germanium is not promoted to DXN members in a meeting because they won't understand things of that. But for a doctor, he understands. So, when we say, when you take Ganoderma, it increases your oxygen carrying capacity. What is the meaning of this? The meaning is, each organic germanium molecule, you have got 3 atoms of oxygen. So, one organic germanium molecule has got 3 atoms of oxygen. So, when you consume more of GL, your oxygen carrying capacity increases. When your oxygen carrying capacity increases, most of the problems they get relieved of. But still we don't say Ganoderma cures any disease, because this is not a medicine sort of thing. But what it enables the body, so that the body is able to take care of that. That is the beauty of it. So which means what? That you don't stop any medicine which you are taking. But what happens is that slowly you need not have to take medicine. That situation, when your body becomes better, which doctor will give you medicine? Or will you go to your doctor? You will not first of all go to your doctor. Second thing, but that doesn't mean that you stop all your medicines with Ganoderma without consulting your doctor. That is another part of it. You go to your doctor, consult everything. But Ganoderma is a must for every single person. The doctor gets convinced. That is how we have been able to convince the doctors. You see, it's a very interesting question that you have asked. It is the mind of many people, and many people have asked me this question as well. It's very simple actually. Now, before I answering your question directly, we will go on a reverse process. Now, why a doctor does not prescribe this? Rather than making him prescribe, the question is why he is hesitating to prescribe this. It's basically because in our promotion, we tend to go and tell a doctor an alternative medicine. This is an alternative medicine. The moment you use this word alternative medicine, doctor gets stuck in his mind that this is a medicine competing with my medicine. Now the moment doctor thinks that he is competing with his medicine, then first of all he will tend to reject. You know why he rejects? Because he doesn't have a knowledge of Ganoderma product. No doctor will prescribe a medicine if he is not knowledgeable about a product. Now supposing I give you an antibiotic, for example. Now the name of an antibiotic, I don't want to name that, but anyway. But if I give a name of an antibiotic and you as a doctor, if you use it, first of all you should know what it is. Unless you know, you will not use. So it is not that Ganoderma they reject something which they don't know. This is the first principle. The second principle is that if he has to use it, then you should know about the product. This is very important. The third is that Ganoderma should be promoted not as an alternative medicine. If it is promoted as an alternative medicine, any doctor will reject. Now what we say, look at the other way. Supposing, look at a patient is in the hospital. Now he is having some disease. So doctor is giving him some medicine. Now once he recovers from the disease, what he is required, his body is already depleted of micro minerals, you have got vitamins, and also what the doctor does at the end, after he getting discharged, doctor writes some vitamins, he writes some B complex, he writes some multivitamins, all those things he writes. Now why does he write? That is not a medicine, it's a supplement. But why does he write? Because the body requires micro minerals, phytominerals, all these things are required, so he prescribes that. So no doctor rejects it. So why he reject Ganoderma? Because he doesn't know about Ganoderma. So whose duty it is? It is our duty. So when we go discharge our duty, we become over enthusiastic. We go and tell, no doctor, this is very good for diabetes, this is very good for asthma, this is very good for cancer. No, doctor is confused. Because doctor is trained to look diabetes as a diabetes medicine, BP as BP medicine, joint pain as a joint pain medicine. You say one for everything. Now which doctor will accept? No doctor will accept it. This is where our problem is in the promotion only. If your promotion is different, you make a slight shift. How do you do that? Doctor, my request is, anyway when you are prescribing a medicine to a patient, do you prescribe vitamins and minerals? Yes, I do. When you prescribe vitamins and minerals, can you prescribe Ganoderma? It contains the same better vitamins and minerals. Supposing, let us say a B complex. Now you have got a few vitamin B elements are there. You have got B1, B6, B12 and all those things are there. But they don't give a toxin cleanser. Now they don't give a balancer, a hormonal imbalance. For example, a vitamin A does not give you an hormonal rebalancing activity. Supposing I give you a product which also contains vitamins and minerals, also a cleanser, also a balancer, also a nutrient. Why cannot you prescribe, doctor? Now no doctor will say no. But before that, he may ask you information. So you have to give information. That is what is very important. So which means that our people have got to be trained about this Ganoderma, not as a medicine, alternative medicine, as a product information. You have to give. This is very important. Now I train my people this way only. I tell my doctors this way only. And once they use it and they come and tell me, I feel more energetic. I see. If you are more energetic, what were you before? No, I used to feel tired but now I am not feeling tired. So if you are not feeling tired, why don't you continue? Now this is what happens.